questions given to me was, can eczema be cured? It depends on what sort of eczema it is. Some of them is genetic defect, so we can't change the genes, obviously. But genetic defect is not the death sentence. Everyone don't have a perfect genes. Genetic defect may cause body imbalance, and that body imbalance will cause the symptoms. So in theory, we can't change the genes, but we can change the body imbalance by using external treatment and internal adjustment. Then we can have a very good quality of life. That person can have symptoms-free life, but the genes might be passed to the next generation. On the other hand, some eczemas such as contact dermatitis, it is curable because those are due to irritants or something that can damage the surface of the skin, causing the inflammations and allergic reactions. So as long as we remove the irritants and we reduce the inflammation and then we repay the skin barrier, so this kind of eczema is curable. Okay, commonly we will think about soap-free wash, we will think about moisturizer, we might use steroid cream or herbal creams or some sort of repairing creams. When you step up again, some doctors might give you something like a disease-modifying agent, something like methotrexate, cyclosporins, and even biologics. The treatment should be personalized. This is because everyone might have different genes in response to different treatment, or they have different type of eczema. The third one is they might have other complications to come with eczema, such as bacterial infections, viral infections, or fungal infections. So this may lead to different treatments. Some of them might have a lot of wounds, and some of them have dry patches. So the one with the weeping wounds, we shouldn't use, in my opinion, water best treatments such as moisturizer or lotion. This is a misconception by a lot of healthcare professionals, including doctors and patients. A lot of them, they go to buy lotions recommended by someone online. Actually, they can't use that if they have a lot of wounds, especially on babies. In my opinion, they should use oil-based treatment so that it's less stinging. In fact, it's not stinging at all, and then we can achieve the same result or even better result due to the fact that the water will cause more inflammations when it stings the wound. So the personalized treatment is so important that we never listen to the sharing. Sometimes online people like to put their questions online, get opinions from different parties. I think sometimes it may worsen the situation due to the fact that the treatment will work for them might not work for you, due to the fact that their eczema might not be the same as you, due to the fact that they might have underlying conditions, or you might have underlying conditions that cannot share the same treatment. Otherwise, things will get worse. And in fact, in my practice, we get a lot of these kind of cases that they use the treatments that workable for their friends, but when they apply on themselves, and it make it worse. We receive a lot of people, they buy creams online. So those are the herbal, they claim it to be a herbal cream, but in fact we found that those claimed to be herbal cream has very strong steroid. Now there is nothing wrong with the steroid use, either orally or topically, in my opinion, but we need to know what strength it is, what type it is, what limitation it is, how to protect your skin or yourself or your child's skin before you apply the steroid. If we know, we can choose the correct one with the correct formulation and limit to the time that which is allowed. When we have to do that, we have to do the repairing stage. If you use something claimed to be herbal, but in fact it has got some steroid in certain degrees, can be strong, can be mild, but we don't know the limitation of it. A lot of people assume it is safe, and long-term application can cause side effects such as steroid dependence. So once we want to withdraw you or your child from this, there's a lot of work that we have to do. It is doable, don't get me wrong, we can still withdraw that patient from steroid using correct method, which is comfortable. There's no need to be something like withdrawal symptoms online posted by a lot of patients that they have this scaly, peeling kind of skin, horrible, situation for 1 to 2 years. There's no need to do so. Okay, we have methods to help the person to withdraw the steroid from the body using comfortable way so that they have better quality of life. Okay, now we have a very big question. It is a very straightforward answer, which is no. You may pass the genes to your next generation, means to children, but you can't pass eczema to your friends or your husband or anyone that get contact with you. This is because it is not due to any infectious disease. It is due to purely damage of your skin barrier by an irritant or your genetic defect that cause these symptoms. Eczema can affect any age group. We have seen a lot of newborns, 3 weeks, 1 month. And we've seen a lot of patients which is 90 years old. It depends on what sort of eczema. Something like seborrheic dermatitis, it can affect the patients from very young age, a few weeks to a few months old. Normally it happens less than 3 months old babies. And then we have this atopic dermatitis, mostly happen around 5 or 3 to 4, it depends. Some of them, they carry the disease up to adulthood. We get this stasis dermatitis, which is due to the blood flow issues and normally affect the lower part of the limbs, and that's normally happen to elderlies due to the blood flow issues. Then we do have this contact dermatitis, happens to mummies or hairdressers, occupational issues that needs them to contact with chemicals. So these are the contact dermatitis. So because we have different sort of eczema, we can't define an age. Okay, eczema is a term. It's a term. Under the term, you have got a big umbrella that covers a lot of types of eczema. So different sort of eczema, it can happen at different age. So it can be any age affected by different sort of eczema. So that's my answer. Yes, I experienced, and some of my colleagues experienced these kinds of symptoms happen to our patients after COVID-19 vaccinations or infected by the COVID-19 virus. The only thing that I can say is the incidence increased dramatically after this vaccination and infection. Whether or not they cause the symptoms directly, this one I don't know, because we don't have a solid studies about that. I can only share by using my experience and what I see. To me, it's possible that's because the virus or the vaccination can turn on the genes, and it may cause the autoimmune disease, which is the stirred up of the immune systems that causing the white blood cells to attack the skin spontaneously. So yeah, we do see this kind of phenomenon now. That is true to me.